And good afternoon to everyone, and welcome to Viewpoint for today. I'm here with Stacey Ann Violinas, who is from Nurses We Care Foundation. And of course, they are planning on having a brunch that they usually keep on an annual basis, and they're sharing it with the general public and those of you who would like to support what the nurses do. And of course, we will have a conversation about their work and the whole 9 yards, and also show them some love and appreciation for what they do. Their service, of course, is often very much underrated and goes off the radar quite a lot, unless by chance you happen to be in the hospital and have to experience the care that they give, and in other institutions as well that takes care of both our elderly and those who are a little bit how do you call it, Stacey Ann? You have a nice name for those persons who are physically handicapped. You don't like the word handicap. What's that?
They are differently abled.
Let's change it up a little bit. Good afternoon to you.
Good afternoon, Wendell.
And welcome to the show.
Thank you very much for having me.
All right. Now you can clarify for me that nice word that you used to describe those folks who are wheelchair bound and have a deficiency or one leg. What do you call them?
We call them differently abled. So we are no longer saying handicap.
And maybe you should explain why.
Why? Because persons that are challenged in whatever area of the challenge that may be, they don't want to be labeled as such.
But they're not really handicapped, are they?
They are not handicapped.
Yeah, because the handicap is
that word has been stigmatized for many, many years, and now we are trying our best to stay away from that language.
Okay. It's kind of demeaning, you think?
It's demeaning and it's degrading.
Yeah.
Yes.
Mm-hmm. All right. I just wanted to throw that in there as part of what nurses do on a daily basis, because usually when we think of nurses, the first thing we think of is who is at your bedside.
Correct.
Delivering care. But there is more to it than just that, right, as far as nurses is concerned?
Yes, there is a lot more. Again, nursing is very wide. So it's not only about the persons that you see in white at your bedside. Mm-hmm. You have nurses in different institutions. You have nurses that are in your doctor's office. You have nurses that works in the insurance companies. You have nurses that are in the district. You have nurses that are in hospice. You have nurses that are specialized in dialysis, nurses that are specialized in cardiology, in pediatric, in ICU, different levels of nursing. You have nurses that are also into coding. You have nurses that are into technology. So the body of nursing is very wide.
Yeah. Realize that. Did you say nurses that work with doctors' offices?
Yes.
They're all nurses.
Yes.
Okay. So you're here to talk a little bit about the plans that you have for
healthcare workers and
nurses.
Yes.
And when you say healthcare workers, again, it is not just nurses.
It's not just nurses. I'm extending it to persons that are able to take care of you. So the person that prepare your meals, the person that make your bed, the person that work in the lab, the person that when you go to the lab, to the X-ray department, they take your X-rays, they do your MRIs, they take your blood. Anyone that deals with care, they are considered healthcare workers. The EMTs, the ambulance personnel, all those fall under the hospice of healthcare workers.
Why did you decided if this question is really for you, or you must have had some knowledge of how this Nurses We Care Foundation was set up?
How we started?
What was the motivation to get it started?
The motivation behind Nurses We Care Foundation came about in two folds. Number one, we as healthcare workers and as nurses, we always take care of people. We take care of everybody. Yet we do not take time to take care of ourselves. Nurses go through the same ailment as everybody else. They suffer with high blood pressure. They suffer with diabetes. They suffer with high cholesterol, arthritis, back pain, knee pain, everything else. However, on the days that you're off, majority of the time, you're just in your bed, you're just sleeping. After you have taken care of your household, you have done your laundry and so forth, you want to catch up on sleep. And this is how it came about. We decided, a group of us as nurses in different institutions, hey, let's do a survey to see what do nurses really do on the days that they're off. How do they take time to care for themselves? And based on the survey, we decided, hey, this is not good. It's not good for our mental health. It's not good for us physically. It's not good for us in any aspect as a healthcare worker.
Getcha.
So we decided, hey, I know there would never be a time when you would get all the nurses to come together. However, there have to be some type of entertainment where we can come together on a specific day and we can just relax. You don't have to think about work. You don't have to think about anything else, even though work will still come into play, because there are often times when we're at gathering and you would think of an event or a patient or a family member, and that would come into play. However, on the day of the brunch, when we decided to organize a brunch, the idea was just to get nurses and healthcare workers to come in an atmosphere where they're able to relax and unwind and have fun. So this is where it came about.
Okay. You outline a lot of things that might be not always good for nurses, even when they're off. What about sometimes when you're off, do you get called into work?
Yes, because sometimes nurses are on call, healthcare workers are on call 24 hours, depending on the department that they work in. So sometimes they are at the brunch, but they're not really settled into the brunch, because you never know when an emergency might arise and you would have to leave for whatever reason. So yes, there are times when you are on call and it affects your sleeping pattern. It affects everything that you do around that period of time.
So you're going to have a brunch which would afford healthcare workers to get a chance to let themselves loose. I mean,
Yes.
something else that people might want to know is that you use the opportunity as well to dress like you're getting married.
Yes, we use that.
I'm using the word getting married, but what I do mean by that is you look for your Sunday best.
Yes,
And
you
you
look
get
for
the
your Sunday
hats
best.
out.
This is the time where you dress to impress. So there is always a theme that is attached to the nurses brunch, and this year is no exception.
Yeah.
Our theme is old Hollywood. So old and golden Hollywood. And you get the opportunity to come out of your comfort zone. It gives you a chance to really take time and put an outfit together. You know, you want to be able to come out in your Sunday best, as you mentioned. You want to be able to go and have your makeup done, have your nails done, have your lashes done and everything else, and come out in full numbers. Yes.
All right. Okay. About the event, you have often make mention of persons who would like to show appreciation, maybe because at one point they spent some time in the hospital and was really cared for, and the care that was rendered or maybe admired, and people want to, say thank you. You think the brunch is one way that such persons can think? Tell us how that would work and what you want people who want to support what you're doing or show appreciation or say thank you can do.
Now, getting a ticket sponsor for a nurse, always, whenever we have to deliver a ticket to someone that a person, an admirer, or someone that you touch decided, let me sponsor this nurse, you have to see the light on those nurses' face. Like, they are so appreciative that someone is, recognize their worth, and they want to acknowledge them by sponsoring a ticket. Now, sponsoring a ticket for a nurse is one way of saying thank you. And you might think it's a small act of kindness, but you don't know the amount the person, the nurse, is so overwhelmed, and they appreciate it. The very fact that it was taught about, So yes, again, this is one way of showing appreciation, because one way or the other, you will be in the hospital, you will be touched by a nurse or more than one nurses or any healthcare professional. Now, not saying that I am advocating for persons to get sick, but this is the reality of it, right? We all get aches and pain. We all get sick. We have to go to the hospital for various reasons, whether to visit someone or for yourself, whether you have to go and you have to take an x-ray or take your blood or something, consult with one of our specialists or anything, meet our dietitians or the very amount of persons that we have in healthcare. So again, you will be touched by a nurse or a healthcare worker. And it's not only about our doctors and it's not only about our nurses, it's about the person that is preparing your food. It's about the persons that make sure that you have clean linen on your bed. It's about the person that is cleaning the floor after you have gone in. You're too sick or you're too weak to even wipe the floor if you have an accident. Those persons have to go in and they have to ensure that your surrounding is clean in order for the other person. So those are also considered healthcare workers, and we need to show appreciation for them as well.
Do you think nurses get, because most people think of the doctors are the ones who are all important, because they're the one diagnosing your illness. Do you think you get enough?
Do we get enough recognition?
Or at least the importance of the work you do? You think it's recognized?
Now, without having, I don't want to sound too biased, because then they're going to say, what about the police? What about our teachers? Do they get enough recognition? And I would say no. No, we do not. As professionals in whatever field, in whatever aspect you choose to go in terms of your profession, no one is going to say that they get enough recognition for what they do. And it's the same for nurses. But yet, society cannot function without us. And even though persons might feel that, yes, the doctors are doing the most, but that's not true. Doctors, they're there and they have studied longer than us as nurses. Yes, they have a higher degree than us as nurses. Yes. However, majority of the times, you only see your doctor for 15 minutes, if so much, because they have so many patients. But your nurse is the one that advocates for you. Your nurse is the one that really knows the ins and outs of the care that you're supposed to get. When your doctor is going to prescribe medication, your nurse is going to the doctor and saying, Doc, I do not believe that this medication is working. How can we probably change the medication, or can we include a dietitian? Can we include the physiotherapist? Because the care is not going accordingly. So your nurses are your advocates. And a lot of times you're a patient on the bed, you don't know these things. But this is what we do. And nurses, actually, we are the ones that do your diagnosis first before you're seen by your doctor. Yes.
So nurses actually play a very important role. I think
a vital role.
It's only thought of, though, when people
you only think about your healthcare workers and your nurses when you happen to be in our care. Because if you're a healthy person going about your business, you're not thinking about the nurses and the doctors and your healthcare professionals. You're not.
Yeah.
And I mean, that is just the reality of it. You don't think about things until you're affected.
Yeah.
Yeah.
You need special skills, or is there something that you have to be born with, or I think you get where I'm coming from, to actually function as a nurse? Because at the end of the day, even inside, a lot of things often happen that people who sometimes don't want to deal with a nurse, or they don't want anyone in the room, that kind of stuff. But if you're going to be real, okay, fine. But there got to be something else that would make you do what they don't want you to do. What's that? What is it?
You asked if there's a special skill.
Yeah.
There is a special skill, because you have to love taking care of people. And one thing that I always tell my students, I cannot teach you empathy. I cannot. Empathy cannot be taught. However, that have to come from within.
Yeah.
You have to be able to have that when you are caring for someone, you get that fulfillment that this person will feel as though, this nurse is doing or has done their best. So that is a skill that have to come from you as a person, that you love, care. And we know that this profession, you are not going to get rich.
Yeah.
You're not going to get rich. But however, for myself, and I can speak for myself, but I can also attest with some of my colleagues that nursing is something that I don't see myself doing anything else, because this is what I was born to do. I love it. And oftentimes when I walk the street and I might see patient that I have had an encounter with in many years, and they say, "Hey, nursey," and I was like, "Oh, I don't remember." And they're like, "You have done this and that." It gives, it's a good feeling.
Certain amount of satisfaction.
Yes, it's a good feeling.
I guess you said exactly what I thought you really need to get across to the public. It's a noble profession, and if you don't have it in you, you won't function properly.
No.
If it's about the 8 hours, 1,000 whatever a week or whatever the pay is, it's not going to work.
It's not going to work.
Yeah, you gotta love it.
Definitely, it's not
It's a
going to
noble
work.
profession. Yeah. So you're taking them out of their routine. I wouldn't
Yeah.
even say comfort zone, but that routine of out caring for patients. Now is the time to focus on
Themselves.
Yeah.
Yeah.
So, okay. So, this would happen when, and what you want the general public to know in which way they can contribute or assist with.
So
with
the event,
this.
Nurses We Care Brunch, is happening December 6th. Is usually the first Saturday in December. And I know there are other activities that is happening during this time. However, this event will be held early. So we're starting at 11 and we're ending at 3. That way we allow people to get a chance to go to other events if they choose to.
Oh, so it starts in the morning.
So it starts in the morning. And this time we're hosting it at the new Mona Lisa Lounge that is on Canigita Street. So we're expecting to have our nurses to come out. I know we would not get the amount of nurses because persons are still working, and there would never be a time that you see all 2,000 and plus nurses in one setting. That just would not happen. But we are hoping that as many can come out, and they also get the chance to, if they're working the afternoon, that they leave around 2:30 to get to their regular shifts. Again, I'm asking the public, the population, that you can sponsor a nurse. Show an act of gratitude by sponsoring a ticket. The ticket is only $50, and we tend to keep the price of the tickets minimal because we know how it is in terms of funding and monies and whatever. I must tell you, though, that this year, every year I realize that it's getting a lot more difficult in terms of getting sponsors to sponsor any event, especially for a nursing event. And this year was really zero. However, the event must go on because nurses, we are here to stay. We are in the community. And even though a lot more nurses are now stepping away from the bedside, but not all nurses will get the opportunity to step away from the bedside. But nurses and healthcare workers, we're around. We're not going anywhere. Yes, we have some that have retired, but once a nurse, always a nurse. And if a nurse or a healthcare worker has impacted your life in such a way, we're in the season of giving. Why not sponsor a nurse? Take this as an opportunity to say thank you for all that you have done throughout the years or throughout the time that this person has touched you or helped you or, gain some type of respect to yourself or your family members. Now is the time. Yeah. So again, it's December 6th. We start at 11 to 3. It's at the new Mona Lisa Lounge on Canigita Street, and we're inviting all nurses and healthcare workers to come out and be a part of this spectacular brunch.
How is the process of sponsoring a nurse can work?
So what happens if you're interested in sponsoring, you can contact any one of the Nurses We Care Foundation members, and you can tell us the name of the person, name of the nurse or the healthcare worker that you're sponsoring, and we will have that ticket delivered to the individual.
Is there a number that they can
Yes,
reach
the
out?
number that I can be reached, 523-1797.
1797. And that is primarily for those persons who, would like to sponsor
Yes,
a nurse.
would like to sponsor a nurse.
Can it be donated for any nurse?
Any nurse.
Or you may have one in particular that you like to?
Any
benefit
nurse.
from
If
this?
you have a preference, what happen a lot of time, persons are sponsoring nurse, they don't really have a name, and they would say give it to anyone or a senior nurse or anyone. But if you have a particular name or the department that they probably work in, it doesn't necessarily have to be the St.Maarten Medical Center, because you don't only find nurses at St.Maarten Medical Center.
It can be
You
anywhere
find
else.
nurses at the White and Yellow Cross, you find nurses in the district, you find nurses in the doctor's office again, you find nurses in the lab. Different areas in healthcare that you just have to give us the name and their place of work, and we
Alright.
will get those tickets delivered.
Stacey and Violinus, you are the president of Nurses We Care, are you?
No, I'm not the president anymore. I passed on that baton to Carlene Griffith.
Okay. So what role do you play? PR then?
I am the PR, yes. And then I assist Carlene because she's relatively new in the position. So
All right. All right, let's take a break quickly. I'm here again with Stacey and Violinus, representing Nurses We Care. They're planning a brunch for healthcare workers, and that will be on December 6th. They're giving you all the details in regards to that. Take a break and come back. Viewpoint. Stacey, and I believe I have a caller. Somebody wants to donate something, so let me go to the... Good afternoon, caller. Go ahead, you're on.
Good afternoon. How you doing?
I'm good, thank you.
Okay, I'm just calling and to send the first pledge to anybody. I'll donate the $50 and you all have fun.
Wow. You want to give some more information in regards to how they can reach you?
I will find individuals.
You'll find it. But you are saying that you will kindly donate a ticket to one of the healthcare workers for
That's
this
correct.
branch. All right. Well, thank you so very much. Well, I don't need to say thank you. I think it's in your place, Stacey, and to respond to the caller.
thank you very much, caller.
All right, y'all have a good day.
Thank you very much.
All right.
All right. Well, there you have it. At least there are someone who feel that it is deserving. Joanne. Okay. Thank you so very much. Okay. The thing is, when people respond that way, it shows that there are people who, unlike how most of us would want to think, there are those who appreciate the work that you do as healthcare workers in the community.
Indeed.
And it should be, the volume should be more, but whatever it is, it does signal that they represent a certain percentage of thing. And you say that this thing it's all about the nurses. So maybe you want to, if you don't mind, describe for us what that whole event is going to be like.
So pretty much once we organize a Nurses We Care brunch, our brunch goes from the time you arrive. So we usually start at 11 a.m. where we would have our welcome. We have our mimosa bar, bottomless mimosa bar, which is most nurses look forward to that. We have our mimosas, we have our welcome, we have our guest speaker. And this year, our theme is nurturing the nurse within. And as for one of the questions that you asked me, who care for the nurses? Now, again, nurses usually takes care of everyone. No one takes care of us. So this year theme is so fitting. So our guest speaker will focus on nurturing the nurses within. We have prizes, we have raffles, we have food and drinks, we have dance, we have quite a few entertainment. And again, this is where nurses now get to unwind and have a good time. So this is pretty much in a nutshell what you can expect to encounter once you have come to any of our brunches. And most of the time, this is our 7th year that you'll be hosting and organizing a brunch of this magnitude. I don't remember ever getting a negative feedback, you know? However, we do welcome negative feedback because that is how you grow and you know what to work on for the next time. But persons do enjoy coming to one of our brunches. And this year is no different, of course.
Do nurses have fun? They
I would say
dance?
yes.
They, you know,
I would say yes.
You seem
Nurses,
to be locked into just what you
when
do.
nurses are not in scrubs and they're in their regular uniform, they do have fun. And again, the nurses that we have now, they are not as the nurses that you know back then. Back then they were, rigid and strict. So now they're a lot more free. So when they're not working and they're in their own setting and a setting that they're comfortable with, they do have fun. Yes.
Okay. What else is there that you think should be a part of this conversation as far as the work you do and the time you take off to be able to, let your hair down and enjoy yourself a little bit? What if there has to be an interruption? You could never tell, an emergency, and you have to leave. And then you are all gathered one place in big numbers, which leaves a few remaining to give care.
No, that is not possible.
It's not
Why?
possible.
Why is it not possible? Because majority of nurses work shifts. So there is always someone to cover a shift. Or if that is not happening and the nurse, for instance, is working in the morning, the afternoon, and the night. So there are 3 shifts: morning, evening, and night. I mentioned before, there will never be a time that you get over 2,000 something nurses in one setting. That's just not going to happen. Because even though some nurses are out having fun, the work continues.
Yeah.
So that would never happen. So yes, you might have persons at the brunch that have to work. So they would come in, have some fun, and then after that, they go to their respective workplaces. So that is what is
So
going to
there
happen.
will be the possibility of shared experience.
There is a possibility of shared experience.
Yeah,
shared
yeah. Come in the
experience,
morning, leave for the
yes,
afternoon.
but the work must continue.
Yeah.
Yeah.
I guess those who are privileged to stay all day.
And then
is
those that
because
are
they're off.
privileged is because they're off. Or what happened, because persons know exactly when the brunch is approaching, they would request that day off.
Are those nurses, well, I have to be careful because there are male nurses too. I don't know if you have any around.
Yes, we have a few male nurses.
But are they allowed to bring their partner to these things? So this
Yes,
is
they
primarily
can.
care?
They can bring their partners. It's allowed. It's not only, again, majority of the times, let me rephrase that. Most healthcare workers, nurses, are females. And it's not by design. It's just what it is.
Yeah.
That it have less male and more female in the healthcare field.
Yes, yes.
However, to be a part of the brunch, the male can come with their partners, their wives, their girlfriend, whatever it is that they might consider the person to be. They are invited as well. So it's not that it's only for you and you're going to hang with your friends or your colleagues. No, some persons prefer to hang with their partners, and that is also allowed.
How do the nurses react to this type of setting, and what do they look forward to, or if they do at all?
Nurses look forward to the endless mimosas. Nurses look forward to our guest speakers because every year we try to bring something new, something fresh, something educational, something that is worthwhile listening to. And we talk a lot about health and wellness. Why do we talk about health and wellness? Because it is something that is no longer taboo. It's something that we are seeing unfolding itself, unraveling itself every day in terms of mental health. And yes, now you're hearing persons talking about mental health, mental health, mental health.
Yeah.
But mental health has always been there. It's only now coming to the forefront where people are now, paying attention because they have family members that act a little strange, quote unquote. Yeah, they're acting a little strange. Or they're hidden because they don't want people to know, or they're acting out differently. However, nurses also goes through the same situations where, things happen and they cannot put it down. It affects them mentally. It affects them physically. It challenges you. That is why for us as healthcare workers and as members of the Nurses We Care Foundation, we advocate for health and wellness so much.
I wrote down mindset here, which was to ask you a question about that state of mind, but I think you use a better word that is more contemporary, if I may add it.
Yeah.
Because everyone has to deal with mental health, including the nurse.
Exactly.
And the mindset that I was getting at is addressing the issue of your mental health. But you go through certain stress and issues that affect your mental health.
We all go through certain stress and certain issues. We all go through one way or the other. Not everyone is privy to say what is happening, because also a lot of times people say things or certain things that they do, or you're thinking, oh, this person don't care.
Yeah.
However, we are not at liberty to, we can shun it. However, it manifests itself in different ways. It manifests its ways in how you treat people, how you interact. If you're a person that is very jovial, you realize that you're withdrawn, you don't want to communicate as much, and you can see it because you can only mask it for so long, and oftentimes it plays itself in a negative aspect that you don't want.
Yeah.
Now it's up to the individual or person that is in the professional field to see it, acknowledge it, and ask or tell you that, hey, I see that you're displaying such and such of behavior. Maybe you want to look into it. Or if you're not receptive to that information, I should be able to relay this information to someone else. But this is in the realm of healthcare. It's different for persons that are on the outside that really don't understand or know what to look for.
Why is my mind, and I'm speaking for myself at this moment, is stationed and anchored in the hospital when I think of nurses, when in fact that's not the reality?
I don't think you're the only person that thinks that healthcare only starts in the hospital. I don't think so. A lot of persons believe that if you're not in a hospital setting, that the person they're not doing the job of a nurse, and that is so far from the truth. Because you go to school and you study. Some nurses study for longer than 4 years period because they go on to get their masters and their bachelors or PhD. But not nurses are designed to be at the bedside. Some nurses are designed to write protocols and policies, and now that we are so big into digital technology, some nurses go into that field, as well as travel nursing. Travel nursing is very big, not on St.Maarten, but in the wider countries. Travel nursing. So you have nurses that are in different levels. Some that are in the community, district nurses, those that go to persons' home, persons that are on we call it the last office, and they have to be in a hospice situation. And you find nurses that are in the hospital that are caring for persons that are dying.
Yeah.
So it's not, I would like persons to not only think that a nurse only is in the hospital, because you really need to broaden your horizon. You really need to do a lot more research or ask questions, because that is not true.
How do you activate, or do you ever be in a situation where you're not on the job, but as a nurse, something happens and the nursing whatever is activated. You ever had that situation?
Can I, for myself, I am always a nurse. I'm always a nurse first. So when situation arise, my nursing cap is always on because that is how I function. That is how I think because I work on adrenaline. So there is no way that I would see something, even though I might tell myself I don't want to go to that person, because you also have to respect person's privacy and person's rights.
Yeah.
You always have to think first, and your safety comes first because this is what you were taught. But regardless of the situation, I am a nurse first. So it comes naturally to me that I need to be a humanitarian. That is just what it is.
You mentioned a little bit about, which shouldn't be overlooked. People deserve privacy. Are you saying that you should ask permission
Yes.
to help before
You should ask permission.
administer help?
Yes, you should ask permission before you administer help. I know oftentimes quick judgment that you want to go and you want to,
But in
save
the case
lives.
of an emergency, you still have to ask
You
permission.
should.
Yeah.
You should. As well as you do not have to help. You do not always have to render aid.
Yeah, but you wouldn't do that though. If you're available to give assistance and maybe save a life.
If the scene is not safe,
Yeah.
you don't have to. You can wait. Because, for instance, if there is a motor vehicle accident or gunshot shooting, or if there's shooting, by right, you have to wait for the police before you even go to render aid. So again, I said, if the scene is not safe,
Yeah.
safety always comes first
Okay.
before you can give assistance. But can you imagine if something happened and you are now going to assist and the patient said, I don't need your help? Is their right to refuse? And you're not in a hospital setting.
Did we have this conversation before?
No.
I think, yes, we did.
We did?
I think, but it had more to do with the disabled folks
Oh, yes.
who might be in a
Yes.
wheelchair.
Yes. And also for persons that are differently abled, you should ask them, can I help you? Because it's their right to say no, it's their right to refuse.
Yeah, but wouldn't that trigger a negative response as well? Because who tell you that I can't help myself?
That's why you have to ask, because you see someone that is in need, according to you. That person is in need of help. That person is in need of care. And you're now going, for instance, to help them with their wheelchair. And they said, I can do it myself.
But you don't feel no way when that is said, though.
No, because by right, it's their right to refuse. Because now you going to help them is as though you are taking away their independence. That's why it's always important to ask, would you like me to help you? Can I help you?
Get them first to confirm
Yes.
that they can do with your help. Or
And it's in all situations. Sometimes it might seem inhumane or a person is inconsiderate or, whatever. But that is the correct way. That is the right way.
I'm happy to have this conversation with you. And I take you even off of what is your primary reason for being here. You want people to know about the brunch.
Yes.
But I think for some reason, how do people should be thinking more about people who are ill and those persons who are administering care?
Let's do a scenario. Let's do a scenario window. Do you remember that our EMT workers or ambulance department, along with the firefighters, that they were on strike, quote unquote strike? Now, can you imagine if all healthcare workers decide to go on strike? Can you imagine if The nurses from the prison decide they're not working. The nurses in the doctor's office decide they're not working. The nurses in the district decide that they're not working. The ambulance team decide we are definitely not working. And every last one of our medical professional decide we are not working for 2 days. Can you imagine what would happen to our island?
And hence the reason why we should think more of them
And
the
this
important role
is
they
the
play.
reason why I am always advocating for nurse, and not because I am a nurse. Yes, pretty much because I am a nurse.
Yeah, you're going to be biased.
I am going to be biased
Yeah.
because this is just what it is. There is no way that our society can function
Without those
without healthcare workers.
Yeah. We saw that when we had COVID and the hurricane, because the frontline workers comes right into the picture as the most important people. They were
Exactly.
cared for in a special way. Hence,
And this is why it shouldn't be, there should not even be a second thought when nurses or healthcare workers are advocating for what they believe that they're worth, and it have to really take that long. Should not be.
yeah, the important role you play only comes into the picture when it's a crisis.
Only when it's a crisis that we are taught about or we are given some type of recognition.
Yeah.
But after that crisis has come to somewhat abate, then what? Then we are no longer important. Our services is no longer important. And that's really sad.
Well, go girl. If it's a time for you to just let, I use the word let your hair down, because that's one of the
Yeah.
terminology used for people who are going to go out to the max.
Yes.
You're going to have your brunch on the 6th of December. And all the healthcare workers that can be available would be there to enjoy this.
Yes.
And you're saying if anyone would like to show love and sponsor a nurse, they can do so by getting in touch
They
with you.
can get in contact with me at 523-1797.
1797. It's not too late, right?
No, it's definitely not too late.
All right. Pocket is empty. Stacey Ann, it's always nice having a chat with you about healthcare and the whole 9 yards. The last time I had the conversation with you about
Yeah. Disability awareness. We
yeah.
spoke about different
Disabled.
disabled persons.
Yeah.
Yes.
And I believe, for the good of my listening audience, you spend more time in that area, do you?
Yes. Now I am no longer in the St.Maarten Medical Center. I'm at the White Yellow Cross, where I manage persons that are differently abled, guided living. Yeah.
Okay. But you still have...
Oh, yes. Once a
that's-
nurse, always a nurse. And this is a profession that I love. I love my profession.
Yeah.
Yes.
When you love what you do it with all that is within you. All right. So, folks, if you want to... $50 is the amount that you can donate to the cause and sponsor a nurse, which will put a smile on their face knowing that they don't have to fork that money up. Already, they would like to make more money. Let me keep my mouth shut. But success, and I wish you all the best, and continue
you.
to do what you do. And on behalf of St.Maarten, we really do appreciate the work you do.
Thank you.
Most of us only do so when we find ourselves in the worst condition. But I think, generally speaking, people would have respect and appreciate the work that nurses do, nurses and healthcare workers
Yes.
in general, and everybody else, but we can only speak for healthcare workers at this time.
At this time.
Because
yeah.
this is what we're talking about. All right. So, well, thank you for coming in and sharing that. I hope you get more people who would be willing to... don't you have to pay for the venue and all that kind of
Yes,
stuff?
we have to pay for
So-
everything. We have to pay for everything.
So they can make a generous donation.
I would
as well.
hope so. I
Yeah.
would hope so. It's not too late. It's not too late.
All right. Again, her number, if you care to get in touch with her, whatever little would be appreciated, I'm sure. 523-1797. Ask for Stacey Ann Violinas. She's the one that could arrange everything and make sure that that nurse. And I want to thank the caller who, out of the goodness of his heart, decided that he should throw something in and sponsor a nurse. And I'm sure that somebody would be smiling. Right, Stacey Ann?
Yeah. most
Because
definitely.
they won't have to pay for.
Yes.
Yeah. And let your hair down. Dress up. Bring
Well,
some
I don't have
pictures.
any hair to let down, but I understand. Still the same.
If you're on Facebook, that's the only way you can. She's as bald as they come. She's
As
just
bald
like
as
me.
they come.
Thank you so much for your time.
Thank you for having me.
And for sharing the time with us here on Viewpoint. That's it, folks. Thank you again for joining me on Monday. That's today. We'll be back again tomorrow, Tuesday. So an invitation is extended for you to join us then. In the meantime, you take care of yourself and enjoy your Monday. Goodbye.